Hello everyone, I'm Dr. Sugandha Raghuvanshi and I'm here to talk about hypertension. So let's start it. Hypertension is a worldwide risk factor for cardiovascular disease burden and mortality. Hypertension, also known as high blood pressure, in which the blood pressure in the arteries is persistently elevated. Now let's talk about systolic blood pressure and the diastolic blood pressure. The systolic blood pressure is the pressure exerted when the heart beats and the blood is ejected into the arteries, while the diastolic blood pressure is the pressure in the arteries when the heart rests between the beats. Well, this is the time when the heart fills with blood and gets its oxygen. This is normally 80 mm of mercury, while the systolic blood pressure is normally 120 mm of mercury. In the blood pressure, measurement is written as fraction, where systolic blood pressure is the top number, which is normally 120 mm of mercury, and the diastolic blood pressure is the bottom number, which is normally 80 mm of mercury. There are several ways to classify hypertension, but here we will discuss just two of them. One way through which we can classify hypertension is as per the British Hypertension Society. The categories of hypertension as per above classification is described as optimal if the blood pressure, systolic blood pressure, is less than 120 and the diastolic blood pressure is less than 80 mm Hg. It is said to be normal if the systolic blood pressure is less than 120 to 129 and the diastolic blood pressure is less than 80 to 84 mm of Hg. It is said to be high normal if the systolic blood pressure is less than 130 to 139 mm of Hg and the diastolic blood pressure is between 85 to 89 mm of Hg. Next way to classify hypertension is through grading. Grade 1 or mild means if the systolic blood pressure is between 140 to 159 mm of Hg and the diastolic blood pressure is between 90 to 99 mm of Hg. Grade 2 or moderate means if the systolic blood pressure is between 160 to 179 mm of Hg and the diastolic blood pressure is between 100 to 109 mm of Hg. The grade 3 or the severe stands for systolic blood pressure more than 180 mm of Hg and the diastolic blood pressure is above 110 mm of Hg. The malignant grading stands for diastolic blood pressure which is above 120 mm of Hg. Now let's talk about the types and the etiology of hypertension. We have the primary hypertension, the secondary hypertension, and the pregnancy-induced hypertension. In the primary hypertension, or we can also call it the essential hypertension, there is increase in blood pressure, but we don't know the exact cause behind it. Also, it could be seen in almost 90 to 95% of the total number of hypertensive cases. The cause of the primary hypertension is unknown, but it could also be due to multifactorial reasons, which include the environmental factors like the obesity, alcoholism. Other factors like the genetic factors, the fetal and the humoral factors, which include the autonomic nervous system and the renin-angiotensin system. While in the secondary hypertension, the blood pressure is elevated, but we know the exact cause behind it. Also, it could be seen in 5 to 10% of the total number of hypertensive cases. The causes of the secondary hypertension are the consequences of specific disease or abnormality. These include preeclampsia during pregnancy, renal diseases like the vascular, parenchymal, and the polycystic kidney diseases, drugs including the oral contraceptives, corticosteroids, and the non-steroidal anti-inflammatory drugs, etc. There is other reasons like the coarctation of aorta and the endocrinal diseases like the Cushing syndrome, pheochromocytoma, and hyperaldosteronism, etc. Now, some of the important risk factors for hypertension are excessive intake of sodium in the diet. Age greater than 50 years is also a risk factor. Alcohol intake, smoking, diabetes mellitus, obesity, which is another risk factor, stress, and sedentary lifestyle all increases the risk of developing hypertension. Also, gender and family history, they are among the biggest risk factors. Now let's talk about the pathophysiology of hypertension. Normally, the blood pressure is maintained by four mechanisms. Let's discuss them one by one. The first mechanism we'll discuss is the sympathetic nervous system activities. When the blood pressure is decreasing, the activation of the sympathetic nervous system will occur. The increased sympathetic nervous system activity increases the heart rate and also the cardiac conduction. This increased heart rate and the cardiac conduction produces vasoconstriction in the peripheral arterioles, and this promotes the release of renin from the kidney. And the net effect of this activation is to increase the arterial blood pressure by increasing the cardiac output and the systemic vascular resistance. The second mechanism we'll discuss are the activities of the vascular endothelium. The vascular endothelium is a single cell layer that lines our blood vessels. It will produce vasoactive substances and the growth factors like the nitric oxide, and these substances are potent vasoconstrictors and they increase the blood pressure level. The next mechanism to discuss are the activities of the renal system. Renin converts angiotensinogen into angiotensin 1, which is thereafter converted to angiotensin 2 by an angiotensin converting enzyme, or the ACE, which is found in the lungs. This angiotensin 2 stimulates secretion of aldosterone from the adrenal cortex. This aldosterone causes the tubules of the kidneys to increase the reabsorption of sodium and water into the blood, which increases the volume of fluid in the body, and this increases the blood pressure. The last mechanism we'll talk about are the activities of the endocrine system. When the angiotensin 2 is stimulated in the adrenal cortex, it will secrete aldosterone. This aldosterone then will stimulate the kidneys to retain the sodium and the water, and thus the blood pressure and the cardiac output of the heart will be increased. Moving on to the clinical features. In some patients, the high blood pressure does not produce any symptoms, and this is actually quite dangerous, and that's why hypertension is also known as a silent killer disease. While in some other patients, the symptoms will develop, which may be like severe headache, blurred vision, nausea, dizziness, chest pain, confusions, shortness of breath, fatigue, vomiting, and irregular heartbeats, and papilledema, etc. For the diagnostic evaluation, thorough history taking of the patient and physical examination is needed. Also, monitoring of the vitals is important. Medical history of diabetes mellitus is also critical. Other tests include complete blood count, renal function tests, random blood sugar, urine analysis, also chest x-rays, ECGs, renal ultrasonography, and also 2D echo can be done. Hypertension can cause many complications. On the blood vessels, it may cause atherosclerosis, aneurysms, aortic dissections. On the kidneys, it may produce hematuria, uremia, proteinuria, the chronic kidney diseases. When it involves the heart, it may cause myocardial infarctions, pulmonary edema, cardiac failure. On involving the brain, it may produce hemorrhages, infarctions, seizures, vascular dementia, strokes. When it involves the eye, it may produce hemorrhages, exudates, AV nipping, blindness, and papilledema. Now let's talk about the management of hypertension. Mainly the management of hypertension is possible by two ways. The first way is the lifestyle modification. By changing the lifestyle, we can improve hypertension. And for that, weight reduction, quitting smoking, reducing the alcohol intake, taking less sodium in the diet, and also managing the stress via yoga, via exercises can prevent hypertension. The other way to manage hypertension is through the pharmacological way. And it has few steps. Let's discuss about those steps one by one. The step one is the first choice therapy, and it is for those hypertensive patients who are younger than 55 years. In these, the first choice for initial therapy should be an ACE inhibitor or an angiotensin 2 receptor antagonist if the ACE inhibitor is intolerant. If aged 55 years and over or black patients of any age, the first choice for initial therapy should be either a calcium channel blocker or a thiazide type diuretic. In the step 2, if the initial therapy was with an ACE inhibitor or an angiotensin 2 receptor antagonist, then add a calcium channel blocker or a thiazide type diuretic. If the initial therapy was with calcium channel blocker or a thiazide type diuretic and a second drug is required, then add an ACE inhibitor. In the step 3, if the treatment with the three drugs is required, the combination of ACE inhibitor, calcium channel blocker, and thiazide type diuretic should be used. In the step 4, if the blood pressure remains uncontrolled on adequate doses of the 3 drugs, then consider adding a 4th drug and or seeking an expert advice. If the 4th drug is required, then one of the following should be considered. First, a higher dose of thiazide type diuretic or the addition of another diuretic. Second, beta blockers. And third, selective alpha blockers. So that was all about hypertension. And thanks for watching.